Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting. The date is July 30th of 2026, and it is 4 p.m. At this time, I will call the meeting to order. Our first order of business is Pledge of Allegiance, so please rise for that. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much for that. If everybody would make sure that all of your electronic devices are muted or turned off, I'd appreciate that so we don't have interruptions. Next is a roll call.
Mr. Pig,
I am here.
Dr. Henry, Ms. Stidham,
Here.
Mr. Deal,
Here.
Ms. Taylor.
Here.
We have established a quorum. Next is the reading of the JCHD Mission, Vision, and Purpose. Ms. Stidham, would you please do so?
I'd be happy to.
Thank you.
The mission is to promote positive health outcomes through delivery of foundational public health services. The vision is a healthy Jefferson County. The purpose of the health center, the JCHD is established, maintained, and operated for the improvement of health in all inhabitants of Jefferson County.
Okay, next on the agenda is to approve the agenda. I don't know if we need to make an addendum at this point in time, because after this, we're supposed to go into closed session, and we do not have our attorney. So I don't know how we would proceed with this other than to hold going into that, I don't make the provision to float that closed session until she gets here, because I really don't want to hold up with the meeting because of her. So I guess if I can have an amendment that says when the attorney arrives, we can drop in a closed session, and as for a specific new business topic that we need to discuss. So can I have amendment for that?
So I move to amend the current agenda to include moving the closed session to whatever point the attorney's present.
Do I have a second?
Second.
Okay.
Having a first and a second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Now we need to vote on the amended agenda. So can I have a motion to approve the amended agenda, please?
I'll make a
motion that we approve the amended agenda.
Second.
Thank you. Is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome guests. Now we have Mr. Liederbrand here, so thank you. So next on the agenda was closed session, but we're floating that till the attorney. So moving forward, approval of the minutes and expenditure. So we will approve the June 25th, 2026 minutes. Can I have a first, please?
I make a motion to approve the June 25th meeting minutes.
I'll second.
Okay, having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is approve the June expenditures for $18,250.75. Do I have a motion?
I make a motion to approve June expenditures.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next on the agenda is the approval of the June 2026 electronic payments for a total of $501,156.15. Do I have a motion, please?
I make a motion that we approve the June electronic payments.
I'll second.
We have a first and a second. Is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next on our agenda is the pre-approval of the August 2026 electronic payments. This is for $610,377.00. Do I have a motion?
I'll make a motion to pre-approve the electronic payments for August 2026.
I second that.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, you are on the agenda. You're up for this portion, so go.
Okay, real quick, because we have a few topics other than my report that I want to get to. Update on the old building. It has been listed. I think he's still working on putting some more pictures, like a 3D walkthrough, things like that, but it is on the RE/MAX website. I believe it's listed at around $795,000. Is that right? Yeah. So hopefully we can start getting some hits on that, and he will continue working on getting it updated. I think the last time I talked about some of the projects that we have going on, we were able to complete another one, just crossed off the list today. Steve has been working on the controlled gate access system, and we do now have a automated gate for our fleet parking, and so that's working and going well. The state budget did get finalized, and we are in the new fiscal year for the state. It's kind of, I see different numbers. The number that was given to me was that the Department of Health's final budget is $2,142,916,701. It is lower than 2026, but I don't think we're going to see a big change for what our funding is. I think it looks like there was a $300,000 reduction in some of the core funding. There is some incentive funding they put out there for local health departments to do projects to earn some more incentive funding. They have not sent out exactly how that incentive funding will be set up for us. The other project that we are working on, and Brianne is leading this project, is our Community Health Improvement Plan, the CHIP. I think the last CHIP that we did was 2024, and so this will be for end of 2026 into 2028. And the CHIP is designed to improve the health and well-being of Jefferson County residents, and it builds off the CHAW that Mercy Hospital and other agencies are involved with that help identify key health needs in the community. So we took that and kind of looked at some of the priority areas that they found in that through surveys and different meetings that they had. We feel like we're going to look at access to care is a big issue in the community, obesity and healthy lifestyle, and then cancer rates. And I think that we can look at our programs and build on that to focus on some of these priority areas. And still maintaining what we already do, but try to focus on how to increase those in our area. But anyway, it's in a draft form, we're still working on it. Once that is completed, we'll bring that forward to the board. That's my report. Did I have any questions? Yeah.
Okay, Steve, so they reduced the core funding by $300,000. Do you know how they're going to allocate that?
Yeah, I sent an email today to see if any more on it. I've not seen any more come down on how it's going to be moved, and even with the incentive funding, how that's going to be. We got one email about possibility of the incentive funding, but not real clear. One version is, or some of that money, all health departments will get the same amount, so across the board, and then there'll be more funding available through certain projects that you could do, but I haven't heard any more about that.
Okay, thanks.
So do you want to go back to
I will,
close.
I will defer to our attorney. So we floated the closed session to whenever you would arrive in our amended agenda. So do you wish to, I mean, we can hold off until, do you want to do it now? Because we're just getting to the point where we're going to do the emerging drug trends. Do you want us to finish out Steve's? Well, why don't we just go ahead and finish out Steve's stuff, and then we can do it maybe before, either after public or before public comments? Maybe after. That way, if somebody want to leave. Okay. Why don't you go ahead, Steve, and continue with your stuff here.
Okay, I think it may have been the May board meeting. I did it on my report. I talked about attending the Drug Coalition Drug Education Conference in April, and that there was a topic on the emerging drug trends in our county. And I believe Dennis mentioned he'd like to have an update on that. So I talked to Prevent Ed. They were the ones that presented this, and Emma Wilson with Prevent Ed has come down to talk on this. I think you'll find it very interesting, kind of scary as well. I also will say that Jillian with Department of Health works very closely on these drug issues as well. She does a lot of things in the community, and she's involved with Prevent Ed and other agencies on what we can do. So go ahead, Emma.
I'm a pacer. All right. Well, thanks for having me. I am obviously here on behalf of Prevent Ed. If you're not familiar with us, although that was a great introduction, we are located near Olivet, and not only do we serve St. Louis County, but we do serve a total of 7, including Jefferson County. And we're pretty much a primary prevention agency, so really focusing on those conversations around the harms of alcohol and other drugs. And I'm school-based, so I've been in Hillsborough High School, I'm in Northwest a lot. I'm also in, Northwest, Hillsborough, and Seckman, so part of Fox. And I will say, yes, the emerging drug trends, although they're very scary, some of them are, they're novel in the sense of like maybe more potent than fentanyl, which we'll talk about, but we already have some resources in trying to mitigate some of those harms, right? Like when we think about naloxone. So I'm gonna kind of reiterate that point a lot near the end. But I do actually want to start off by talking about maybe what you've heard referred to as gas station products. So these are a lot of products that are accessible to our young people, and whether the legislation be non-existent around it or there's a lot of like gray areas. And I will say I can talk about these things for probably more than 15 minutes. So if you want to follow up with me after, either in person or via email, that is definitely there. Okay, so you're probably gonna be like, Emma, why are you showing me alcohol trends really quickly? I do just wanna talk about how emerging drug trends doesn't always mean the novel stuff, right? So I do just wanna point out that alcohol trends in young people are starting to trend down. This is a nationwide survey. I'm not gonna like read you every number, but just really giving you the information to publicly available data sources. So this is out of University of Michigan. It's known as the Monitoring the Future survey. You can look at, they have every drug that you can name, and some of them are like daily use, monthly use, lifetime use, but that is definitely a great resource. Similarly, I don't know if you saw this week, I believe on Monday, the National Survey of Drug Use and Health published by SAMHSA. Similarly, we see alcohol starting to trend down a little bit, which is great. And then our Missouri Student Survey from Department of Mental Health, you can see Jefferson County rates are very similar to the state reported past month alcohol use. So it's hovering around that like 6.5%. And I always put a little asterisk there, like that is pulling together our middle and high schoolers. So we don't have the separated out data yet with the middle and high school at the county level. I'm sure we'll see that within a couple months. One thing I will note here is that alcohol and the perception availability is the greatest of any substance that was measured. Last thing I will say about alcohol before we move on are just some of the trends that we've been seeing in our college-aged youth and their parties. So alco pops are kind of making a comeback. I don't know if any of you remember that from Y2K. I was a little kid, so I don't really remember that. But BuzzBalls is the most popular noted brand. Along with Neutral, you will see that a lot actually at professional sporting events as they have like new partnerships. And so I just think about like eyesight of young people. Okay, and then we do have the Sober Curiosity and a trend known as zebra striping, which is just alternating alcohol with water. So I think that kind of trends with what we've been seeing where teen use is starting to go down a little bit. All right, and then the new nicotine product, nicotine pouches. Have any of you heard of these or seen these? Okay, so the pictures that I have are the most common brands from our National Youth Tobacco Survey that was released just a couple months ago. And I think there's this perception that these are gonna be like the quote unquote safe nicotine product in our youth, but it's really just synthetic nicotine, so they kind of skirt around some of those like tobacco restrictions, or calling it tobacco rather. The biggest thing that I usually point out, if I'm gonna keep this as brief as possible, is how much nicotine they really pack into those little pouches. So although it's just staying in the mouth and not entering the lungs, we are still concerned about the absorption of nicotine into the bloodstream and obviously traveling to the underdeveloped brain and the impacts there. And we have a lot of literature supporting how that can impact the development of the prefrontal cortex. Okay, and then moving on, how many, I must have skipped that. How many of you are familiar with all of the hemp discussion at both the state and federal level? There have been a lot of changes just within the last couple months. Okay, so I will say that federally, they, probably like in November, yeah, it was like mid-November, they said there's gonna be a year where this is gonna take an effect where THC cannot exceed a total of 0.4 milligrams, and that's going to include every type of THC that you may have heard of. So whether that be Delta 9, Delta 8, THCO, THCA, whereas before this, and kind of like right now, because it hasn't taken effect yet, the threshold is 0.3% Delta 9. And so this happened in 2018 where it kind of created this, like, again, that legal gray area. Missouri has passed a very similar law where they're going to cap it, just kind of following the federal guidance on that. But if you have no idea what I'm talking about, that's why I had that picture. So Delta 8, again, kind of coming from the hemp plant, which is a type of cannabis, but underneath that THC threshold I mentioned, they don't have to follow the same regulation that we put in place when we passed recreational marijuana in our state a couple years ago. Okay. And then there is a carve out for THC beverages. We've been seeing this trending, a lot of teens starting to drink THC with alcohol, which is particularly concerning. The analogy that I always use, and feel free to steal this in your conversations with young people, it would kind of be like stepping on the gas pedal and the brake of your car at the same time, right? A lot of teens think mixing depressants and stimulants might cancel each other out, but it's actually more likely to stunt the liver's metabolism of alcohol, aka they're going to be intoxicated longer, could also keep them awake longer and encourage binge drinking and a higher BAC. All right, moving on to Kratom, or many of you probably have heard of 7-OH. I do want to point out some other labeling you might see. So MG or MIT, which stands for metragenine. So metragenine is the chemical in the Kratom plant. It occurs in larger amounts naturally in the plant compared to that 7-OH. 7-OH is much more potent, but again, very small amounts naturally in the plant. However, kind of following that same playbook of hemp, they are kind of converting some of that metragenine synthetically in a lab to create much stronger 7-OH. And so I'm gonna probably skip through some of the prevalence of Kratom. Again, I can share this with you later on, but I wanna point out just how potent this is. So Kratom is really interesting. It's a partial opioid agonist. So what that means is it is acting on the same receptors that we see things like morphine bind to. So you may have heard of like the mu receptor, but it also binds to other non-opioid receptors. So that does mean that if somebody has too much of this product, naloxone's gonna work, right? But if there's too much of it and they're sticking to the other receptors that are not, for instance, mu, then it could be harder for them to have like a rebound, if you will. So 13 to 22% more potent than morphine. A lot of this started with a brand called Feel Free. That brand has since faced like legal action. You won't really see that anymore, but some of the brands we have been seeing, excuse me, I'm gonna actually jump through this really quick. This is the picture I wanna show you. So what do you notice other than the fact that they are definitely stealing some other classic like pharmaceutical opioid names? So we have like Dopium, Perks with a K. So some people refer to this as like a gas station heroin. Gas station heroin could also refer to something known as tianeptine. So some young people will refer to this also as like Zaza, which I think can be confusing because Zaza also sometimes refers to like marijuana. So I usually just stick with tianeptine for the purpose of this. So it is sold as another like opioid-like supplement. Similarly, it's going to stick to that mu receptor. I'm going to recommend naloxone. Although the evidence, as far as like clinical guidance, there's not like anything published in that regard. But I think just based on the mechanism and what we do know, worst case scenario, I think just go ahead and administer naloxone and Narcan. Because a lot of times with situations, you're going to start to notice that the signs of poisoning, they're very similar, right? You're thinking respiratory depression, you're thinking like the heart rate's slowing down, they might be nodding in and out. You're not really gonna know what they took. And so when in doubt, just go ahead and administer. All right, this is an interesting one. So this one is not an opioid-like supplement. It's known as Phenibut, and it's being sold as like an alternative to Xanax. You know, there's definitely a lot of discourse on SSRIs right now and people seeking alternatives for that. So this is a supplement that doesn't have to go through the same like rigorous testing as some of our pharmaceuticals. I will say also that in other nations, they do use this in a prescription form. However, they're using it in very low doses, like 25 up to 50 milligrams. But when it's sold in a supplement form, we don't really know what the dosage is, right? Like the label doesn't necessarily have to match what's physically in the product. Oh, and that also leads me to my quick little side note about designer benzos. You might see that a little bit more when we talk about the illicit supply, but this is just a good little bridge to that. Okay, and then nitrous oxide's making a comeback, y'all. Unfortunately. So whippets, as many of us refer to them as, really popularized by Galaxy Gas. There was a TikTok that went viral, I want to say 2023, that TikTok has since been removed, but I think that really encouraged young interest. And mushroom edibles. This is my last gas station product. And this is not psilocybin or psilocin that I'm talking about. This is a chemical compound known as mucimol. And so it typically comes from a mushroom known as, I'm gonna botch this name, Amanita muscaria. So it's another little legal loophole. We do see a lot of cross-contamination with these products. I myself can see this on my own Amazon. So I just think about young people accessing it. And microdosing, what the heck is a small amount? Okay, so bottom line, I think with the supplements, there's gonna be a lot of mixed opinion about it. I think at the end of the day, if it's not rigorously tested and kind of seems like it has all these magical benefits, it probably is like too good to be true. And also, if you take other medications, I would just have a conversation with a clinician about any possible like interaction, because a lot of these are metabolized by the liver. Okay, so now I'm gonna wrap up with the novel synthetics. This is where I'm gonna be throwing out like really high potencies, and again, it can be very nerve-wracking. Just, I think the more that we can equip ourselves with the education and have conversations with young people, it's not necessarily planting ideas, but rather just arming us with tools. So orphines, I'm gonna start with the lowest potency one. It's thought to be around the same potency as fentanyl. It has 7 different names that we know of right now. The most popular one being noted as brofrene. It sounds like I'm saying bro. So in Illinois, I'm going to focus more on that, obviously, since that's our neighbor. It's often used as an adulterant rather than the primary drug that's being sought, which I don't think is too surprising. And it's being found in nitazene, which I will point out on the next slide. And then something that we're more familiar with are illicit stimulants like methamphetamine, illicit amphetamine, I can never say that. I'm not going to pretend how to. Okay. Field test strips do not detect this, so that's a particular concern, but again, hopefully they're being developed. Nitazene, something you probably for sure saw in the news, I would say maybe in March. So in January, a lot of school districts across the state of Missouri did opt in to get their wastewater tested for this. And I believe there was one school in the Fox School District that did test positive. You know, we're not saying that kids were using it. There's a lot of like question marks with that, but we just know that it's here, right? And so some of the nicknames, the most common that I see is ISO. The Tony's a little confusing too, because you may have noticed that was a nickname for the tianeptine I mentioned earlier. And then this one can be up to 43 times more potent than fentanyl. And then carfentanil is believed to be the most potent synthetic opioid on the market right now. It's often being pressed into counterfeit oxycodone tablets, so the M30s, as many people refer to it as. And again, it can be around 100 times more potent than fentanyl. I think we're gonna be living in this constant game of cat and mouse. Like, you ban one thing, they're gonna synthesize something that's even stronger. I'm not necessarily sure what the solution to that is, but I just wanted to point that out. So about 0.2 milligrams is considered a lethal dose. And then, oops, there was one more. Metatomining is another one that you probably have seen a lot in the news. This is not a novel synthetic. Yeah, it's like way near the end. Yeah, so this one is a large mammal sedative, similar to carfentanil in the sense that it's meant to be used on like rhinoceros and elephants. But this one, unfortunately, we don't believe that that naloxone will work on it because, again, it's not binding to that mu receptor. So this one is of particular concern to the point that St. Louis County Health Department, they did issue a health alert in April. Again, it's regarded to be 300 times more potent than xylazine, but interestingly, we do not associate the same wounds with metatomiting that we were seeing with xylazine. I'm not sure what that mechanism of action is, but I did find that particularly interesting. Okay, and last but not least, I just want to point out two more resources and then I'll be done. If you want to kind of keep track, I don't know why I keep saying that, keep track of some of these emerging drug trends, one source that I look at, usually quarterly, because sometimes like things change every single day, right? This particular source, you can use like a QR code, but you can also just search this particular website. It's ndews.org. So it just looks at social media and language around that, and then it kind of shows you like, hey, there's a spike in conversation around this particular substance, and they give you like little one-pagers for each of these, which I find incredibly helpful. And then last but not least, more specific to our area, if you're not familiar with it already, Project Eaglefang, they do quarterly drug checking. So they use like maybe empty baggies that, I'm just using this as an example, from our street supply, and then they physically test it. The last quarter had around 40 samples, so small samples, right, when you think about statistical power, but it does kind of give us a better sense of what's going on. And you can see kind of on the right hand, that bottom corner, where methamphetamine, cocaine are actually what they're finding the most of. So I think this indicates towards a trend of stimulants coming back. Kind of like how clothes trends cycle, I think kind of doing the same thing with depressants now, swinging back to stimulants. Okay, that's all I have. I know that was a lot, but again, I wanted to kind of keep that in, hopefully what was 15 minutes. I didn't wear my watch today, but I can stick around or definitely contact me. I have plenty of talking kits and one-pagers on this if you want to share it with your specific community. Thank you.
Thank you. Does any of the board have any questions?
I have a quick question. Could you say potentially you think some of these products will cause mental health issues or suicidal thoughts in
Yeah.
some of these children, or?
I would say that my research topic that I spend the most time with is some of those synthetic cannabinoids that are higher potency. Definitely more and more literature about the correlation between suicidal ideation and psychosis. There was a great study that was published, and it's like in every conference now, where having just one psychotic break from one of these substances, specifically THC, 50% of those cases can turn into either bipolar disorder or schizophrenia. Yeah. As far as those novel synthetics, I don't know. Yeah. That's a really great question.
All right, well, thank you very much.
Yeah, thank you.
All right, next, my favorite topic, let's not eat any lettuce today, right?
Thanks, Emma.
Oh, no, yeah. I won't get into that.
I appreciate you coming down. That was a lot of information to put in. I appreciate it.
Thank
though.
you.
Thank you. So yeah, if you've been watching the news, there's a
Cyclospora.
major outbreak, cyclospora. We've had, cyclospora has been around, but we've had this recent outbreak. If I looked at our CD reports, we've not had any cases up until this month. And you got them all in 1 month. So I thought it'd be a good time for Sarah to come up and Dan, just to talk on how something like this affects the health department, and it doesn't affect just one section, but how we work as a team in reviewing this outbreak.
Good afternoon, everybody. So my name is Sarah. I am the Communicable Disease Supervisor and our epidemiologist here at the Health Department. I'm here to talk about what my team does when a large-scale outbreak like this happens with the cyclospora. So cyclosporiasis is a reportable disease in the state of Missouri, which means that healthcare providers are required to report any positive tests to health agencies, whether it be their local or their state. So cyclosporiasis is not a new disease. We do typically see about 2 to 4 cases every summer. Once our team receives those positive labs, along with the patient's demographics, we call them for an interview. So the cyclosporiasis interview is much more lengthy than our typical enteric disease, like a salmonella or a CAMPI. We gather very detailed food history from the 2 weeks prior to somebody getting sick. So to give you an example, a salmonella interview on paper would be about 2 pages long. The cyclosporiasis interview is 12 pages on paper. Now, we do actually do all of that on the computer now, and there are a few extra questions into that, but they do take a while. Overall, in a large-scale outbreak like this, a nationwide outbreak situation, us at the health department here locally are really just data collectors. We're the ones gathering all that important information about where and when someone ate different foods during that incubation period, which is the 2 weeks before they got sick. Once that information is entered into our state surveillance system, the state and then also the CDC, they gather that information. They're the ones who use it to connect all of the dots about what food might be the source or what location might be the source of the outbreak. Last I checked, Missouri has reported around 600 cases so far, but that number is very quickly growing every single day. Currently here in Jefferson County, we have had 62 cases reported to us since July 6th, so not even a full month. And like I said before, generally we only see about 2 or 4 on average every summer. So currently we still have 30 of those cases open, which means that we're still in the process of investigating and interviewing. We've closed the rest of those and confirmed that they are confirmed cases. That is all I have. Does anybody have any questions about it?
Do you know there many deaths from that so far?
Any what?
Deaths?
No.
Like in older, elderly people? or
Not that I
so
know of.
far? Or anywhere that you know of?
I have not heard of any so
Okay.
far. That's the good thing is, antibiotics tend to kill this parasite or it's easy to recover from at home. Not easy, but,
So those numbers are lab confirmed?
Mhm.
And the state's testing?
I don't
No.
believe so, yeah.
We checked this week, and the state is not currently offering testing at the state public health lab.
So these are coming from private providers?
Wow.
Pardon me.
So I wanted to bring
All right.
the other part of what we do would be this has a recall. So thank you, Sarah, for the CD part. And the CD teams actually has several other not outbreaks, other diseases that you're doing as well.
Yeah, summertime is our busiest time of year with all of the tick-borne illnesses, and a lot of the other GI illnesses are pretty high during the summer. We do have a few of those less common conditions that are coming through. A lot of them will be on next month's CD report, since they were all kind of reported in July.
So I asked Dan to come in because there was a recall with the lettuce. And so I wanted him to discuss what environmental does during one of these issues.
Yes, so my name is Dan Kane, I'm the environmental supervisor. I think I've gone over the recall process a few months back, but I'll briefly overview it real quick. So the FDA and USDA group recall announcements into 3 different categories. It's Class 1, Class 2, and Class 3. This recall was a Class 1 recall. The state of Missouri further breaks those categories down into Class 1 high priority, medium priority, and then low priority. So my group, when we receive a Class 1 high recall, we respond to it within 2 working days. And then Class 1 medium are within 3 working days, and then Class 1 lows, which are pretty low priority. They just need to be checked on the next routine inspection or next visit to that facility. So when we receive an email alert with the recall notice, it comes from the state. It comes from the FDA to the state, and then the state sends it to us. Typically, the facility that has the affected product has already received that recall notice up to a week in advance. In this case, I think they received it on July 17th, and then we received our recall notice on the 20th, so about 3 days later. Really, the purpose of us going is to make sure that those facilities are responding to the recall notice that they received. So our visits are called effectiveness checks. We'll go in, we fill out a survey that will say whether the facility had already pulled it from the shelf, or if we had to pull it from the shelf, if it was discarded in the stockroom, or if it was in the stockroom labeled not for sale. There's lots of different questions on there that we answer in regards to the recall. All that information is sent to the state so that they can keep that data on which facilities are responding to these recalls. Just a few numbers too. So far this year, we've had 7 Class 1 recalls. All of these recalls were responded within 2 days. And it totals up to about 55 facilities so far that we've responded to for different recalls. But just a little bit more about this recall specifically. So on July 17th, Taylor Farms of Mexico voluntarily initiated a recall on iceberg lettuce from central Mexico for all product being sold in the U.S. The stores that were affected in Missouri included Walmart and Taco Bell. They were sent this communication, like I said, on the 17th of July, and they began pulling their product. So on Monday, July 20th is when we received the recall notice, and all 4 Walmarts and all 7 Taco Bells were responded to that day. No product was found that was being produced from the Mexican farms or the farms in Mexico. So they had farms that were in California also, but that was not part of the recall. And Taco Bell was the same. They had already pulled all of their products. So And so far, I think the investigation's still going on, like whether there's other products that are affected, but this was the only one that we've gotten a recall for so far.
And I just want to add that I think Sarah touched on how many cases that we have, and we have enough cases that her staff couldn't do all the investigations. So they came to me this morning about what could be done, and we asked environmental to use some of the field inspectors. And because I went back to years ago when I did this, I can remember getting pulled in, having to make phone calls on these investigations. Good experience for anybody to get cross-trained in what goes on in other, in our CD department. So we had several of the environmental staff make phone calls, gathering that information today, more likely tomorrow and maybe next week, just to keep their heads above water as they work through this outbreak. So, any questions on that?
I appreciate you keeping us updated. Thank you.
Thank you both. I know you need to get back to work, don't you? Thank you both.
All righty. So that brings us up to discussion, trustees' questions on the program report. Does anybody have any questions about the other items inside the report? All righty. Next on our agenda is public comments. I think you have come. Mr. Liederbrand, would you going to go ahead and stand up and give us your thing and go ahead?
My name's Alan Liederbrand. Thank you for the opportunity to speak. I just want to make a short comment that the website is improving, but unfortunately was not able to easily find the packet.
I know.
It appears that you were sorting all the records by the title. Well, that's fine, but put the year first and then use a digital for the month, and that way and do it in descending order, and that way the most current information will come to the top of the queue. So other than that, it's looking good, but otherwise you need to put a note out there because I couldn't find it easily.
I recognized that last night after the phone calls back and forth, and I have already talked to Mr. Sykes about that.
Okay,
So
that's great.
We're going to make that, it needs to be chronological.
Well, even on any reports, I think,
Yeah.
if you're going, you like to find the most current thing first, and then as you go tab on each one.
I agree.
You go, farther back. So anyway, thanks.
Thank you.
Thank you.
Okay, now I need a motion to go into closed session. It is for a specific topic, correct? Yes, discussion of pending litigation. Okay. So do I have a motion to go into closed session?
I make a motion, we go into closed session.
Second.
We have a first and a second. I need to go back to my page. This is pursuant to 610.021, confidential privileged communications between the Board of Trustees and Harris County Health Department representatives and its attorneys and records which are protected from disclosure by law. I will need a roll call.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
And we will be back after this intermittent closed session to complete the rest of our transactions on the new business